Hit Exchange Media Coverage, HIMSS 11.
Speak to some examples, case studies, examples where you've been able to go in with the client, really lead them through what can be a very complicated and laborious process, successes that you have, things that maybe you've learned along the way that maybe you could share with our audience.
Yeah, well, I mean, the ED is one of the most challenging places to implement software, and unfortunately that often leads hospitals to ignore the emergency department until later phase of going to an electronic record, and it's a mistake. The reason it's a mistake is because number one, the ED has the best return on investment of any software product in the hospital. Right. So you can count the ROI in the way of months. Secondly, it's really the information that is most important to have electronic, and I'll give you an example why. Somebody's admitted upstairs, they're upstairs for 3 or 4 days, you generate a discharge instruction. Yeah, that's not as time sensitive as a patient that's seen in the emergency department today, because as soon as that patient finishes their visit, the private attending needs to know about it, it needs to be transmitted into the HIE exchange and such. So it really is the clinical record that is most relevant to be electric, because you need to transmit it very quickly. It also offers tremendous value in the way of risk management, because once again, it's the place where you sometimes have seconds or minutes to determine what you need to do for a patient. So having an electronic record that allows you to immediately find the old record right there is vitally important.
Catch the premiere issue of Hit Exchange magazine or visit hitexchangemedia.com for more healthcare technology news and information.